Hi, I'm Dr. Paul. I am one of the founders of MD Pharma Pain Relief, and I wanted to tell you my story about how I discovered Cobra Venom as a way to manage my pain. So it actually goes all the way back to 2000. However, it was preceded by the fact that my father had chronic back pain for decades, and often he would be confined to bed for several days at a time just because he couldn't function, and there was no resolution to the pain situation. He did spinal fusions, he had back braces, and so when the opportunity presented itself, I was adamant that that was not going to happen to me, so I would do what I could to stay fit and healthy. So when I went to college, I would regularly go to the gym and I would participate in sports. And then in 2000, I was playing tennis against an opponent that I never beat, and being very competitive, I hated losing. So during this match, she did a sly lob over the net, and I was adamant I was going to get it. So I exploded forward and then felt this massive wrenching pain in my back, and I just fell on the ground. And I lay there for what seemed like an eternity with a pain that was like 10 out of 10. And then after I managed to kind of struggle back to my feet, I went back home, and that pain didn't resolve over the course of a couple of days. So I went to a doctor, and this particular physician suggested that maybe a direct injection of steroids would help. And so I tried that, and in fact it gave me some immediate relief. Didn't clear the pain completely, but at least I could get up and walk around and function, because I could barely move. And subsequent to that, then I tried a lot of different types of treatments. I tried, acupuncture. I tried chiropractic manipulations, which often would make it worse. I tried the at the time in the early 2000s, there was a traction device. I think it was called the DRX 3000, and that felt good while I was being stretched, but I was unable to get off the table when it finished. I had to roll off onto a wheelchair to be able to go into a room where they would apply TENS machines to help try and relax the muscles. I did go in 2004 to go see a surgeon in Miami who was one of the top specialists for back pain, and he suggested that disc replacement surgery might be an option, but only if I was in extreme pain. Now, however, I wasn't really in extreme pain. I was probably averaging about 6 out of 10 on a kind of a bad day. But for over the next 10 years or so, almost 10 years, my average pain level on my back was about 4 out of 10. If I had a bad day, it was 6 out of 10, and I had a really bad day, it was like 11 out of 10. I couldn't even get out of the bed. And it wouldn't take very much to provoke it. In fact, one stage I was changing my oldest daughter's diaper, and I just turned to get the diaper, and I felt a little click in my back, and then all of a sudden it went into a complete spasm, and I could barely walk. I was at a hotel attending a function on the beach, and I had to walk out of that building holding the walls. I could have really done with a wheelchair, and the following day I was supposed to go to Paris, so I had to get in the plane. So I went back to the same doctor that had helped me before, and I begged him to give me that steroid shot in the spine again, and he wouldn't do it. He felt it was too risky, it could cause complications, and so he offered me Percocets. And so when I got on the plane, in fact I couldn't really walk to the plane. I had to get a wheelchair. I was mortified. I had to get a wheelchair, be wheeled through the airport, through security, a wheelchair onto the plane so I could get into the seat. And I was taking 2 Percocets every 3 hours, and by the end of that flight I was taking 3 Percocets every 2 hours, and eventually they were having no effect, so I just threw them away after about two or 3 days. I guess with the opioid issues we're having now, that's probably was a good thing, but clearly I didn't respond well to opioids. And so that experience then encouraged me to try and look for a solution or something that might help. And having a degree in science, I was a neurobiologist by training, and I was specializing in the use of snake venoms as therapeutic agents. So at the suggestion of a colleague of mine, Professor Zhenhong Qin, who was at Suzhou University in China, he suggested that I should come over in 2007 and visit, do a kind of a tour of snake venom hospitals. So in China they have literally hospitals that are set up to treat patients with, a lot of Chinese traditional medicine, but it includes venoms. And they would often have snakes out, literally out the back of the hospital, and they would milk the snakes and then dry the venom and put it into capsules, and then they'd hand that to their patients. And I thought that seemed, could be dangerous, but that was not toxic. And they said basically that everything was fine, never a problem, and it seemed to help a great deal with pain, and they were giving it to patients with cancer and stuff like that, and it seemed to give them good relief. And so that was actually at a hospital that was just north of Beijing. We did some other tours of some other sites, but that idea kind of cemented itself at the time of hearing that little story. So when I got back to the United States, I got back to our lab, so I started feeding cobra venom to mice to see what would happen, and they had no problem drinking this stuff. Normally what would be considered many times, thousands of times the lethal doses, they were drinking the venom, they were growing, gaining weight and growing bigger. No sign of toxicity at all. And so one day I thought it was time for me to try it. Now, dogma says that you cannot drink a protein solution, which is really what cobra venom is, and have it, get to the stomach and bypass the digestive process. But I thought, well, give it a shot anyway and see what happens. It clearly was safe, it wasn't toxic, didn't show any problems with mice. And so I took a dose, a reasonably large dose, and for the first time I actually slept through the night. Now, up to that time, for those who are familiar with back pain, it was not unusual for me to have to sleep in the fetal position. I couldn't lie straight down on my back, I couldn't sleep face down, so I'd always sleep with my knees up near my chest, and I'd wake up many times during the night. So to actually sleep through the night was pretty amazing. And so I began to continue to use it to see how much relief I'd get. And ultimately I got down to a pain level that might have been maybe a 1 out of 10. And then ultimately with continued use, I was able to essentially forget that I had any pain in my back at all. Nice thing about it too was that the stiffness, where you'd feel like you were like 90 years old, where you couldn't get in and get out of a car, for example, after a long trip, you kind of had to unfold yourself as you stepped out of the car, or if you were seated for a while, then that went away. And so that gave me a lot of flexibility, and I was able to get back to the gym and work out and do all that sort of stuff. And I found the longer I was using the venom, the better it was working. And so you didn't have to take it as frequently as when you start. And it takes a while for it to wear off. So we created this interesting spray, and you just spray it into your mouth, and you take it regularly, several times a day. And then it takes a couple of days to work, so it doesn't work immediately. It needs to modify your immune system. It's really an anti-inflammatory product, but it takes a couple of days for it to kick in. And then once it kicks in, you kind of ease off on the dose, and then you get to a maintenance program. So now I've been using it. I started using it in 2009, and I've been using it now for 14 years. And I've taken very large quantities without any problems. I've seen many doctors, I've done loads of blood tests, never had any problems with my blood tests. I can tell you it does not lower your cholesterol levels, right? But outside of that, I had absolutely no problems. And I'm thankful to have actually managed to take what Chinese medicine was using as a standard practice and put it to very good use in a form that's extremely safe and easy to use.